I work within GP practices, taking referrals for patients where there's a social need that needs to be addressed. So as a link worker, we'll work with a really broad range of people over the age of 18, giving them more time than what they'd normally get in a healthcare environment. That's often people with long-term chronic conditions, people facing challenging life circumstances. So it could be that someone's unemployed or signed off work with stress, or it could be someone caring for a relative where, their health is very poor and they need a lot of support. There isn't a set pathway to becoming a social prescribing link worker. Myself, I've got a background in coaching and teaching. I think the core skills are probably around life experience and people being able to connect with other people on different levels. Having said that, what we are seeing in recent years is people coming from social work, teaching or counselling backgrounds. Usually a primary care network will have some funding available for social prescribing link workers. Often you'll see one or maybe two social prescribing link workers working in one GP surgery. So it really is those communication skills where we can identify what people's goals are and what their challenges are. And often that can take a couple of sessions. The second part of the role is around guiding people, being a friendly guide to help them access resources, often resources in their local community that they would otherwise not have known about. For me, a personalised care approach is about starting with the person and what matters to them, giving space so that they can lead the conversation and having lots and lots of time to explore what their goals are and what their challenges might be. A strength or asset-based approach is starting with what's going well in a person's life. Often people will come in and tell you what's wrong with them or what's going wrong with them, but we like to try to focus on what's going well and what resources they have that they can build on. Part of the role is keeping your ears to the ground and knowing what's going on in your community. So link workers will have devoted time to getting out there and meeting community leaders, community groups, finding out what's going on. Of course, we work within a professional healthcare environment, so we need to be able to work with people safely and skillfully, but there's also an element of being a friendly guide to people. Where the link worker role can have a huge impact is building a relationship with someone. And in that relationship, we get to find out what that person likes, what their challenges are, and what their goals are. And we try to help that person to take small steps towards better health and well-being. And from there, we can see if there are other opportunities in their life or in their local community for them to connect. Because we know that when people are connected, they can better meet their needs and enjoy life.